people kind of show up. But we can do the non-action items as Dr. Miller said. I would also like to welcome Jill to the table. You're familiar with what we do, but it's nice to have another person at the table. A new face, thank you. Okay, well, I'll do the roll call, I guess. So, Anthony, are you here?
I sure am.
Denise is here,
Yes.
last she checked. Jill?
Yes.
No Martin, no Gina. And Molly's here.
Joe, we just want to know, Gina and Jennifer are excused.
Yes, I do know about Gina and Jennifer being excused. But Mark is not excused, nor is Jeff, or Tim, or Martin. And Martin doesn't usually miss meetings, so there was a fire in Covelo yesterday afternoon, so I don't know if that caused any kind of problems for him. All right. We can't approve the agenda, and we don't have a quorum, but we can take public comments. So is there anybody out there that would like to speak?
They all have places on the agenda.
They all have faces on the agenda. How about that little person? Is she on the agenda?
She's up first.
Okay. Anyway, all righty. We can't approve the minutes. Can we hear what people are talking about?
Yeah.
Dr. Miller?
Yes.
Okey-doke. So, Mendocino County Youth Project Report. Amanda, are you here? And who are you?
Anna Rodriguez.
Okay. And you said Rodriguez?
Yes.
Okay, thank you.
So we have a few updates, staffing and hire updates. We have just hired a full-time MFT intern. We currently have traineeship site agreements with PHSW and MSW students to include therapeutic services capacity and support local mental health provider students. The schools that we're currently working with are CSU Long Beach and Humboldt State University. We also have hired 5 paraprofessional hires. 4 of them are care managers, and then 1 peer youth worker. We also would like to announce that we've opened a Covelo office drop-in center that will be having its grand opening on July 2nd. I have a few flyers and things like that we can pass out as well. The gateway services that we'll be providing out there are going to be snacks, meals, availability of basic need essentials, referrals, resources, clothing, personal needs via Happy Thrift, our clothing closet that we have open here in Ukiah will be also opening one over in Covelo as well.
Oh, good.
Positive youth development activities, peer support. We will be open Tuesdays and Thursdays beginning as of 7-2 from, actually so sorry, I don't have those hours, but the grand opening will be from 1 to 3 p.m. But we will be open every Tuesday and every Thursday for additional services. Additional events will be scheduled and announced really soon. For our Ukiah activities, we will be holding our summer event. I also have a bunch of flyers for those. We'll be holding them Monday, Wednesdays, and Fridays, starting 6/29, all the way up until August 7th. That's all the updates that I currently have right now. Any questions or anything for us?
I have a question. Will your staff person in Round Valley be a resident there, or will somebody be traveling from Ukiah to there?
We'll be traveling. Our Deputy Executive Director, Mandy Rojas, actually is currently local over there. She actually just made her move out probably a few months ago, so very new out there. But we do have staff that will be traveling from the Ukiah over to Round Valley.
Thank you so much.
Questions?
We'd like a couple of those flyers
Yes,
to
absolutely.
the office.
I'll pass them around. There are a few of them. It includes all of our Ukiah and our Covelo flyers, and we're also updating our website for it to be a bit more like user-friendly and everything, and it's also open for feedback, communication, ideas, insight, or anything else regarding Round Valley or anything else.
No, I love that you're going
Thank you
out
for
there.
coming.
Thanks so much.
There's quite a bit in there. I don't want to just pass them. Thank you so much.
Okay. Redwood Community Services. Oh, we've got a whole gang.
Hi, everyone. Yes, we've got two representatives today. My name is Lindsay Thornton, and I'm the Clinical Adults Program Manager at Stepping Stone's office.
No, what was your last name again, Lindsay?
Thornton.
Thornton. Oh, I should have gotten that one.
And we've got some data information that Taryn is passing around for you all.
Thank you.
Thank you very much. Oh, you're so sweet. I love it. I'm going to make you secretary, is that what you told me?
And we'll go ahead and share a little update, and we'll kind of take our turns, pass it back and forth. So, RCS has completed our first round of collaborative proactive solutions trainings. Collaborative and proactive solutions, CPS, is an evidence-based trauma-informed model created by Dr. Ross Green. It shifts the focus from modifying a child's concerning behavior through words or punishments to identifying the root of unsolved problems causing the behavior. The philosophy is simple: kids do well if they can. Training 6 Mendocino County clinicians. We have a second July cohort starting and are identifying additional clinicians and MHRS staff to attend the training. We began our community resilience model for residential facilities training development. The Community Resiliency Model, CRM, developed by the Trauma Resource Institute, is a biologically based preventative wellness program. It teaches individuals to understand their nervous system's response to stress and trauma, providing simple hands-on skills to calm the body, regulate emotions, and return to a balanced state of well-being. We will train all adult residential, crisis respite, crisis residential, STRTP staff in the 6-hour CRM training, and using this as a structure to reduce burnout in facilities servicing our highest needs, most vulnerable clients.
RCS continues to work in close collaboration with Mendocino County Behavioral and Mental Resources local crisis teams to deliver comprehensive local crisis services. Through ongoing partnership with RCS and PHRS local crisis teams to coordinate closely the response to community needs, strengthening the overall crisis response system 24 hours a day. This collaborative approach has supported the expansion of the crisis care and ensuring that individuals are connected to critical resources and support. Joint efforts include dispatch responses, shared assessments, and triage process, including referrals to acute psychiatric hospitalization when clinically appropriate. Both teams remain committed to stabilizing individuals in the least restrictive environment possible and working together. By working together in the field, RCS and Mendocino County local crisis prioritized de-escalation, community stabilization, and transition outreach services whenever it's needed.
And our board of directors team has been working with Cal Poly Humboldt and Chico State to build more solidified partnerships in building our MSW workforce in Mendocino County. Specifically, we do have a few active internships right now, one at Stepping Stones. I know we've got one at Lake County, and then we'll also be having, supporting someone in August with their internship as well. And I wanted to share a success story for one of our programs. 2 members of our Restorative Justice Youth Project through the Arbor have been collaborating with the U.S. Army Corps of Engineers program. These youth have been gaining skills by aiding in project management and mitigation efforts and helping restore and clear a few of the campgrounds around Lake Mendocino. The young adults showed dedication to their volunteer work by promoting labor efforts in maintaining vegetation management and completing a safety walkthrough in these specific areas. They both look forward to future involvement, which includes a variety of new projects. Specifically, they are eager to practice woodworking skills that will consist of building and standing planter boxes for the surrounding recreational areas. Is there any questions for anyone?
I have a question, but I'm not sure if you're prepared to answer it. We'll see. The crisis clients served by month. For last summer, the adults were at 247, and then this last month it was at 115, which is a pretty drastic drop.
Significant drop.
Can you tell me more about that, or are you unsure?
What we've noticed is that there's a lot of people that already are connected, but there has been less people overall who are in crisis as well as people who are being able to connect to long-term services. We also had a large amount of people from out of town who were residents who were actively who were in crisis who had to actively work in the emergency room. So it's a little bit different. It's like we're just not as many people are in crisis. We have so much people connected, less out of town.
Okay, thank you.
Do you see an uptick when people, we're just starting our tourist season. Do you see an uptick of people in crisis during the tourist season, generally?
But the tourist season is kind of different because we see a lot of people when it just starts getting warmer in general. They start walking on specific coast trails who are just coming to Fort Bragg. So it starts a little bit before just the regular tourist season.
But you do see an uptick.
And we also see it when it's really cold too.
That, I didn't realize we had that during tourist season as well. Thank you. Okay.
All right, thank you for your time.
Thank you for being here. Okay, Tapestry.
Hello, everybody. I'm Brian Erickson, Operations Development Director at Tapestry Family Services. This is Brianna, who's running North Carolina, joining me today to share some amazing information. I'm happy to be able to report that the Parent-Child Interactive Therapy, or PCIT van that I've been talking about for months is finally finished. We have it. It's already started going out into remote areas to provide PCIT services. And at the end of this meeting, I'd like to invite everyone out to the parking lot where I have the van, where you can actually do a tour.
Oh, cool.
We will be doing a grand opening at a later date. We're still working on exactly when we're going to do it because it has been booked. It's been out and about. It is probably more important to do that than to have a fun event. So
That's
it just
what it's for.
happens that, for today, I had it already blocked off, and I wanted to make sure that you had an opportunity to see it, especially since I've been talking about it for a month.
We wouldn't believe you otherwise.
I barely believed it myself. When I went down to pick it up, I had a grin from ear to ear. Driving it back was hard not to feel for a victory tour around Mendocino County. In addition to the van, one of the things that we have starting on Monday, June 29th, as of that day, we will be providing services in Anderson Valley. So we'll actually be providing services out of the Anderson Valley Health Center. So we're utilizing their office space to be able to provide services for those who live in the community. That we've noticed over the past few years that there is a lack of services within that community, and getting engagement consistently coming from Boonville to Ukiah, going to other locations. Sometimes it lasts 1, 2, 3 visits, but it's not ongoing. And we've been working with the Anderson Valley Health Center to utilize the space that they have available so that there can be ongoing services there in the community. So we're very excited about that. We're going to have start off with 2 different therapists. One is bilingual Spanish, to ensure that we are able to provide services that are culturally appropriate for the community. And we've already been staffing up for referrals and getting ready to go. So very exciting news to get that going.
Congratulations.
Thank you. It's definitely a long time coming as well. And one of the greatest things about this collaboration with Anderson Valley Health Center is that the therapists that we have that are going to be working there, they're in Boonville. So they're from that community. We know from long-standing experience, getting someone from Ukiah to go to outlying areas, it works for a year, 2 years, it's not consistent. We've been really trying to work with residents in the communities and developing up. And we're able to see it with Anderson Valley, having these two particular therapists who live in the community. We recently had another therapist join our team who lives in the Caldwell area. So we're building up within those communities so that there's that continuity and consistency. And we don't see people who start off really strong and they go every day for a year, and after a year they say, well, I just can't do this anymore. It's really building that community and building the resource there. And usually, every month I talk about the number of services that we provided. I'm going to just round it instead of giving specific numbers, but the total number of services that we provided from July 1st through May 31st, so this particular fiscal year, was just shy of 30,000. So if you think about that, if you look up at a plane in the sky that's flying up above and it's that little tiny dot, you can see it, one service for every 1 foot that plane's flying, probably. So we've actually done a lot. We've done more this year through May 31st than we did all of the previous fiscal year. So with the expansion of the services that we're providing, the expansion of our team, and also opening up opportunities for different types of services on the coast, with Anderson Valley, and outlying areas, we've seen that grow, and we're seeing the impact every single day.
And this is overall for the whole county.
Overall for the entire county, or just our medical program. And for all of our programs currently, we have actively these 1,037 clients that we're working with in all of our different programs. So when I first started 5.5 years ago, we were stretching it and had a hard time with 125. And now we're seeing over and over.
No, that's a lot of growth that your organization has had, so thank you.
A lot of growth, and a lot of that has to do with the team that we have, and I definitely have to give a lot of credit to our clinical director, Christina O'Hill, the program that she's created. If you look at it, every organization is definitely working with schools to make sure that we are building the infrastructure and building the services that we need to have in our county to meet the needs of our community. And currently we have, today I think we have 7 trainees who are in school getting their master's degrees and completing their education to become therapists. We have 2 more that are starting at the end of the summer, and they're back in school. So we've been in that process of building and continue to do so.
Never ceases to amaze me. You just keep growing.
Any other questions?
No, thank you.
Oh, but didn't we?
I do definitely look forward to seeing you all after the meeting.
All right, thank you, Brian. Paul is not here. He was unable to come. He didn't give a reason for that, Cody? Okay. All right, Anchor Management, please.
Hello, I'm Tim with Anchor Health Management.
Thank you, sir.
Administrator, Manager, Health Management. Good afternoon. So we have a report on the medication clinic, which is basically some of the data that's on those sheets. The clinic both inland and on the coast is operating as usual. The Mental Health Rehabilitation Center opened in May, and we've been onboarding. We have 5 patients currently on board, and let's see, 2 from the jail and a couple from acute and 1 from Crestwood. And we have staffing 24/7 with a nurse and a rehabilitation worker working as a team. And let's see, so Ace Barish is the medical director, and then we have Larry as the provider that works with our population. And we're working on getting through partnership to get our CDT certification, which has been taking a long time to happen. And other than that, we have whole person care that we provide is integrated with specialty mental health services throughout the county. So very proud of that group. So that's pretty much all I have. Any questions?
How many beds do you have?
16.
And so, are you just trying to get your feet under the before you start more people,
We're
or are you
working
not
on a lot
having
of bugs with 5,
referrals?
yeah.
Okay.
Is Dr. Larry the only psychiatrist you have
No, but he's the one that's going to be working with the patients in the
at the new facility?
Okay, thank you.
Thank you. All right. Mendocino County Specialty Mental Health Report, Ms. Lovato.
Good afternoon. So from the programs that are operated in county, we have our mobile outreach and prevention services program. We have definitely seen a lot of staff turnover recently in that, so we've been stretching as much as we can with our teams of mobile crisis and mobile outreach to still meet the needs of the community. But we are definitely actively recruiting and looking for folks who are wanting to do the work in the community and going to folks where they are to fill in some of those vacancies. So we have definitely been continuing to do the mobile outreach activities such as the heads up responses and MOPS responses, but we often do have to fit those in and around our mobile crisis. We have seen in the most recent couple of months a decline during the day of the number of mobile crises calls we're getting. So where we had been getting anywhere from 30 to mid-40s of calls over the early part of the year. We started in the summer, and once the weather got warm, seeing that drop pretty significantly. So we're going to be keeping an eye on that, just as our CS mentioned with their evening hours, to make sure that's not a result of folks not calling when they need the service, but more a result of calling earlier and getting some of the preventative services in place rather than waiting until it becomes a crisis. So we'll be monitoring those 2 service delivery numbers to make sure that that is not a concern. We are definitely seeing our calls resulting in 5150s holding steady in the 2 to 5, 2 to 6 range. So still the majority of our calls do tend to result in stabilization in the community and or voluntary transportation to emergency rooms or other services, but not in an involuntary transport. Our geographic breakdown is pretty evenly split, with the exception of Ukiah. The majority of our calls, 51% in May, were to Ukiah, but we've got about 7 to 10% in the rest of the county, with our lowest numbers being in the city of Mendocino and or the area of Mendocino and Willits. So otherwise, they're a little bit less at about 4% of our calls. Otherwise, most of the other areas are getting a decent number of calls, and those include Fort Bragg, Point Arena, Hopland, Albion, and some of the other areas. So see, other than crisis calls, assisted outpatient treatment has seen an increase in referrals in the last month. So we'd had a period of time where we weren't getting assisted outpatient treatment, and in April and May that has increased, and so we've got a few people going through that therapeutic cohort program. We've also seen an increase in care referrals, and both of those numbers are pretty small, but we've, in the last month and a half, doubled the number of care petitions that we had overall. So the awareness of that program is growing, and that does not mean that those petitions will all result in court-monitored care, because some folks have been able to engage in treatment without the court oversight process, but it's definitely an option for those who need that extra therapeutic process. Let's see, other than that, we've been actively applying for and monitoring processes with a series of grants. Our MHSA programs reported last month, but I know that we talked about a bunch of changes that come effective July 1st, so we're getting contracts done around that and trying to bridge the gap of the regulation changes, and so that's been a more challenging process than it usually is, just because of the reports that are required are completely different, and the service delivery expectations are very, very different. The funding is organized very different, and we've been talking about that a lot, so I won't spend too much time on it, but it definitely has taken up a lot of time and attention, and we do have a little bit of transition time built into some of what we're doing with those to make sure that it's relatively as seamless as we can make it within the changes and the regulation changes. Any questions that I can answer? Thank you.
Okey-doke. So Dr. Miller, would you like to do your report?
Sure. So you have the director report in front of you in your packet. If there is any questions in that, please let me know. And as always, if there's anything else you guys would like to see, we're happy to add to that. We do want to make sure the board is just a reminder to the board that we are in that transition from MHSA to BHSA. We're also in a huge transition with the state of looking at systems and really starting to roll out new data requirements and data looks from a very high level, and even giving things of estimated number of beneficiaries they think should be served between SED and SMI, and they're basing that by county. So there's a lot of higher level review that we're going to start seeing. Some of that is going to require us to start looking really closely at mild, moderate, and severe to make sure that everyone being served meets our criteria as the state starts looking, and we have to start reporting more. Also, we know as we go into BHSA that what we had money-wise has now decreased with the additional categories. So what we had in FSP, now we only have 35% of what we had, and the state is actually estimating how much we should have, and so we are using that state estimate over 3 years. The state is giving us an estimate of what they're projecting we'll have, and so that does mean some decrease in funding that we're going to see across our systems. With that, the state is also doing some deep dives into obviously grievances that we get within our systems. We have to send those up quarterly, and so they're starting to look at those a little bit more intently. So we'll have some feedback more on that as we go forward. Those are in the reports, the grievance we get, but the state is also looking at those on a quarterly basis. I also included in the packet this time the community health needs assessment. The reason I included that, while it's a public health community health needs assessment, because what was identified obviously in our community is behavioral health services, both mental health and substance use, still being a high need in the community, and especially with stigma, discrimination, and access. And so that's definitely one of the community health improvement plans that we are doing through public health. But because it is a focus on behavioral health, it's really important that the behavioral health providers are a part of that team and are participating in that community health improvement plan. So I wanted you guys to be aware of that project because you are the Behavioral Health Board and aware that that is still one of the highest identified
One of
one of the highest identified needs through the individuals who participated in the survey, and then in the data review we did. So there were 787 people who completed the survey and identified what they felt some of their needs were, in addition to what the contractor looked at a variety of different databases to review what our needs was. You'll see there's 5 areas that are identified for community health improvement projects. I'm not going to go through those. The 2 biggest ones for this group that will be important to watch is the mental health substance use one, and the access to care, because it's not just access to care for general health care, it's access to care for behavioral health. And so on the mental health and substance use that we are seeing as still people are finding that they're not able to get it. And that doesn't mean especially mental health, that means behavioral health across the whole spectrum, mild to moderate. So I kind of gave you some legislative updates. In addition, we're continuing to track HR 1, and as the state budget rolls out, any changes that we'll have, and we'll see as our Medi-Cal population changes. The POC date, it's changing, it feels like daily. So I know they're trying to do the TOC, I think in July, and we're still, the generator is not here yet, is what I think I got updated on. So still more to come. Hopefully I'll have more information at the next meeting. But as soon as it's ready to go, I will let you guys know. And Karen kind of touched on our grants. We are applying for grants across the system of the health services, and continuing to look at ways to bring funds in, as we're also, looking at reducing funds through the EHSA system.
Can I ask a question about the assessment?
Yes.
It's a 2024 assessment. How often are those reviewed? And then might that be the next iteration such that we understand what progress has been?
So they're done every 5 years. We're mandated to do a community health needs assessment. This was done, ours were done as a combo between Adventist Health and Public Health. And so it was started in 2024, which is why it says 2024, rolled into 2025. Several of the behavioral health providers were part of those groups. We had stakeholder groups that included behavioral health providers at all levels. And then since then, there is a CHIP committee, so you all should be on that CHIP. If you're not, please let Karen know. She's the lead for that CHIP. That's where the data is coming in. That's where you guys are working across the system. Partnership is a part of that. How we're going to reduce the concerns regarding the lack of mental health substance use services, and stigma and discrimination. A lot of it really focused on stigma and discrimination, but there still is a belief in the community that there's an access to care issue. And the access to care one, there are a variety of people that participate in that, and I know that RCS, Jolene and Victoria attend that one pretty regularly.
Is there any of the regional plans that are participating?
Yeah, partnership is our partnership participants.
The Blue Cross,
We have not been able to get them at the table. They don't have a mandate like the managed care plans do to be a part. So the managed care plans are supposed to be a part. It's kind of a requirement that they participate in these now. We haven't seen that from the private insurance perspective yet. Hopefully.
that means these are going through the
No, it's a whole system. But you also have, the hospitals, Adventist is at that table, and we've been bringing some back to the Healthcare Coalition, because that's also where all the clinics are. Some of the clinics are on different of the calls, so. There's 5 areas if people are interested. Diabetes is one of the ones we're working on. That was a big focus that our Native community asked us to focus on, because it is a huge concern for them. Chronic conditions, we're focusing a lot on cancer and some other chronic conditions, and Angel's our lead for chronic conditions. We have community safety. Tammy Bartolome is our lead for community safety. Then we have the behavioral health. Karen and Andrew are the lead for behavioral health, and then we have access to care, which Karen, I, and Jeremy are my Adventist are the lead on.
Anybody have any more questions? Okay. One of the things that I noticed, and I think 3 of you have mentioned, that we're seeing a drop in crisis. Does that mean people don't know how to get it? Or are we doing so well that people are being managed? Or
So, I mean,
does any of this, I mean, it just,
that's one of the things that I think we definitely want to monitor and look. If we're seeing increases in our other outpatient and outreach and prevention side numbers and crisis drops, then I'd say, yes, that looks more like people are getting interventions earlier and not waiting till things come to crisis, and we're getting successful at allowing symptoms to become a crisis threshold. If we're not seeing those, then that would be concerning. If we were getting, because we also have initiation of crisis response by law enforcement, I would say if we saw a dramatic rise in calls from law enforcement, but not from individuals themselves or family members, that would be a maybe marketing or a community education challenge to look at why aren't people feeling like they can call or know how to call. So I think we need to watch a little bit longer, but as was mentioned earlier, we do see changes in crisis pretty consistently with extreme weather changes, and so until just recently, it hasn't been extremely hot. It's been better weather, without rain, without extreme cold. So we might have people not going into crisis related to environment and situational factors that just make mental health symptoms worse and behavioral health symptoms worse.
thank you for that. I figured you had an answer. Okay. So, board committee reports. I will just tell you, the revised meeting schedule, we're just going to be doing the meeting on the coast, and it's going to be at the Casper Community Center, and it will be alongside Measure B.
That's in August, correct?
That's
I think you
August.
said, yeah.
Right.
Yeah.
Every year, we try to go to Covelo at least once, which we did a couple of months ago, and then to the coast. And I would love to get it so we could go to the South Coast also, but that seems to be a difficult hike for a lot of people, and we get less people showing up.
It's hard to get a quorum.
Well, we're in Ukiah today, and it's hard to get a quorum, so, I don't know but a lot of people don't want to drive, oh my God, I want to drive the coast. Well, that's actually my favorite drive, so.
Mine too, they should think about carpooling.
There you go. All right. Mo, do you have anything?
I do not.
Okey-doke. And Jennifer's not here, and Martin's not here. And I am going to tell you that, well, I guess I can't tell you. I'd have to have a vote to make sure everybody wants to do it, so we can't even do the member appreciation. Tim and Anthony and I have already finished as far as new members, and a letter did go out to Perry saying we thanked her for her service. But we have new members, and thank you for showing up. All righty. Are there any other member comments that we have for today? This has been a huge meeting.
We're gonna go see the van.
We are. That's going to, yeah, you guys all have to go see the van. You can't go home until you see the van.
Well, we have 2 hours left in this meeting, so I think we have time to go.
Are you saying you have a break for 2 hours now?
I'm not saying that. I'm getting messages still, but they can wait.
All right. Anything else from the group here? Okay. Do I hear, can we even make a motion to adjourn without a quorum?
I don't think so. We never made a motion to...
No, we didn't make it, no, we had to, I opened the meeting, but I guess I'll close the meeting then. So it is 1:43.
1:44.
Okay, I'll take it. And we'll close the meeting and we'll all go play in the parking lot. Anyway.